My name is Alyssa. I'm a mom here at Swiss Medica. My son's receiving stem cell therapy treatment, and on my vlog, I've happened to receive a lot of different questions that some of the parents also want to ask a doctor. So I asked if we could talk to Dr. Lana, and she agreed to it. So here are just some of the basic questions that we'll go over. We're going to discuss what stem cells are, what exosomes are, what macrophages are. We're going to talk about how they may help individuals with autism, what the blood-brain barrier is, what we can expect to penetrate or not penetrate the blood-brain barrier, and then experience from the clinic, so from a doctor here at the clinic, what they've seen as a result of these individuals being treated, and then also what negative side effects that we may expect from stem cell therapy, and then also just her personal, opinion on how many rounds she's seen other patients do, if there's like a max amount or not, that kind of thing. But yeah, so we can go ahead and get in it. Dr. Lana, if you want, you can totally tell them how long you've been here or any of your past experiences.
Okay, so hello, my name is Dr. Lana. I'm doctor at Swiss Medica. Also, I'm responsible for research in this clinic. I'm working here for about 4 years now, so I'm glad to be here.
Awesome, we're very glad to have you. Alrighty, now that we know that, let's go ahead and get straight into it. So, Dr. Lana, can you tell me what stem cells are?
So the stem cells are really unique cells in our body. Actually, all of us are just appeared from one stem cell. And all our bodies have the stem cells. They have a very unique abilities. They can restore and regenerate some specific cells in our body. They can differentiate, that means that they can become some specialized cells. And also they can just review, refresh, and keep our body balanced.
Alrighty, no, that is great. So if we were to put it in like layman's terms, would you agree that like stem cells are almost unidentified, like the body essentially tells them what to become? Am I understanding that correctly?
Yes, we can say so, that whenever we need some specialized cells, like if our muscle is damaged, then in this case the stem cells came to this site and restores, regenerate, and these cells become the new muscle cells.
Perfect. No, that's kind of my understanding. I just want to make sure that I'm advising correctly when I say that kind of thing, so I'm glad that you can confirm there. Next up, we have what are exosomes?
Exosomes are small parts from the stem cells. They are not living cells. They kind of small vessels which contain very essential molecules from the stem cells. And this is the way how different cells interact with each other.
Oh, okay. So that's very interesting. So I think I had that a little bit misunderstood when I originally stated what exosomes are, so that makes more sense. So you have a stem cell, they produce these little exosomes, and then those go and do a lot of the work essentially.
Yes, just imagine it as one cell wants to say something to another cell, and it sends a small letter to it. So exosomes is a small letter from one cell to another.
Nope, that makes total sense. Okay, I always thought that exosomes help them thrive longer. No, that makes more sense. They help them be more productive by sending the letter. Got
Exactly.
it. Alrighty, next up we have what are macrophages?
The macrophages are specialized cells of immune system. Their main goal in our body is to detect and destroy some harmful pathogens, like harmful bacteria or some damaged cells which shouldn't be eliminated from the body. So macrophages just come to the site, eats this whole pathogen and throws it away.
Alrighty, okay, and then can you describe the difference between, so I know Oscar received M2 macrophages. Can you explain what the job of M1 and M2 is?
That's very interesting because our immune system, as you know, it can produce the inflammation. It fights from different pathogens.
That's what they explain. Gotcha.
And also the immune system have to calm down after this fight is over, after we are healed. The immune system has to calm down. And here we have two systems inside one. So the first system keeps the inflammation.
It's more of a stage than it is a type.
Yes.
Okay, so you have it in stage 1, inflammation. That's where I was also mistaken. Okay, so stage 1, inflammation. Stage 2, actually repair and inflammize. I don't know. Less inflammation. Get rid of the inflammation.
Right. So we're reducing the inflammation.
Reducing it. There we go. Perfect.
So the M1 macrophage is actually the pro-inflammative. So it makes the inflammation goes on. And the M2 macrophage is something which calms down the immune system and slows down the inflammation.
No, that totally makes sense. Okay, this is good. It's clearing stuff up for me. How can stem cells, exosomes, and macrophages alike, how can they help individuals with autism potentially?
So this is a really big question.
Very big one. We can section it down. We can go step by step. So realistically, we all know, autism, heterogeneous, can have, way different upbringings in every individual. But potentially, I know that some of the studies I looked into showed, there were a few postmortem ones that I looked at, and they said that there was inflammation in the brain at time of death. And it was some of those, this study was only done on autistic individuals, right? So I believe personally, yes, of course, there can be inflammation in the body. So let's start with stem cells. How could stem cells potentially help someone with autism?
So really, the inflammation is one of the causes of autism. Autism is a very complex disease. It's not something which caused by one factor. It may be caused by many. But the neuroinflammation is something that is seen in most of autistic cases. So that means that our main goal with the stem cell treatment is to slow down the inflammation, to reduce it as much as possible, and also to help the brain to restore, regenerate, and work properly. So the stem cells and their exosomes, as the exosomes,
yes, I would say they work hand in hand, so that makes total sense. Okay, the stem cells and their little messengers are the messages that they're sending. Those work hand in hand. And then what is their sole purpose? Is to just
So they slow down the inflammation. They help to create a better environment for the neurons. And also they have a very unique and interesting property for autistic specifically, is that they help to make the proper and the better connections between the neurons. If there are too many of connections, like it's very hard for us to focus. If they're very low of connections, it's very hard to learn something new, because like connections between neurons is something that we know, something that we learn. And in this case, the stem cells help to create the perfect amount of connections, not too small, not too big. And this helps to learn anything new, starting from speech, learning the habits, the daily routines, and to have the better performance at school. So it all depends on the inflammation and how the neurons connect to each other.
Alrighty, no, that makes sense already. So with that, I feel like it's pretty easy to go into what macrophages can actually do for them too, because they're also taking away that inflammation, reducing it. And so those also step in and allow the stem cells and the exosomes to actually serve their purpose, essentially?
Yes, that's true. Like for macrophages, the most essential is these exosomes from macrophages, these small letters from macrophages, because as you know, we have different ways how we can treat. We can do the infusion with macrophages, or we also can give some medications based on exosomes of macrophages. And these small particles from macrophages help a lot with the brain, and all the research which we made all over the world, showing that they specifically help to develop better speech. So we do not know for sure why the speech is the most which benefits from macrophages, but as we notice that children benefit with speech, it is a very good way to help children, because their speech is the biggest problem for them.
Oh, okay. That is interesting. Okay, I'm just continuing to learn new things today. Okay. Alrighty, that is awesome information. Next up, let's go ahead and get into a common question that I'm getting is blood-brain barrier. Can you tell us what even is the blood-brain barrier? I think it's self-explanatory, but let's go ahead. I'll have you explain to me what it is in more professional terms.
Okay, I'll try to be easygoing, just not to bother you a lot.
I think I know what it is, like the blood and brain, the barrier between the two. But I could be, essentially, I think that's layman's terms, but if you can give us an official what its purpose is, that might be helpful for some of them as well.
So why do we need barrier? Usually we need the barrier just to protect something which is very special and very important for us. So all the organs which are highly, extremely, we need them a lot to stay alive, to stay healthy. They are surrounded by a specific barrier, which doesn't let any harmful substances to follow it. So the brain has this barrier because this is essential for our living. And this barrier doesn't let all the other kind of cells that shouldn't be there, let there. So, for example, some kind of immune cells cannot reach the blood-brain barrier, because if they go there, they can harm the brain. So it is very, very hard actually to reach it. But the good news that exosomes, they are so small and they can easily go through the blood-brain barrier.
Alrighty, no, that makes total sense. And I think that's another question that, yeah, I'm sure we can go in more depth down. I was like, I'm pretty sure that's on here. Alrighty, and so with that, with the knowledge of what the blood-brain barrier is, the next question was what can and cannot penetrate the blood-brain barrier. Like you said, it's to keep out pathogens. Kind of reminds me of like a grape, right? We put grape into like, river water, and we know if we peel the grape, it has the good water inside, and it worked as like a membrane, right? Like a barrier at the outside of the grape.
Sure.
So that makes sense. And so then, can you talk more into like the exosomes, how they're able to penetrate the blood-brain barrier? And I know the methods here are, do any of the ones in the IV go through? Do any of the ones in the intramuscular injection go through? And do any of the ones in the nasal spray? And maybe which ones are you targeting? Where are those all targeting? And maybe it's all the same. This is just something I haven't asked yet. So give me whatever you got.
Okay, so for exosomes, as I mentioned, it's easier to go through the blood-brain barrier. When we do the infusion, just intravenous infusion, the stem cells stay inside the blood vessels. They cannot penetrate the blood-brain barrier. But the small exosomes from the cells can do that. This can happen from all the blood system inside the brain. They can penetrate whenever they want. And also we have the specific method of treatment is when we give the exosomes via nasal spray, as you mentioned.
Yeah, I was going to say, so the nasal passages being so local.
Yes, they are too close to the brain. So from the nasal cavity, they can go straight through the membrane, and they go specifically to the area which we want to target. So yes, this is very good that we have such a very nice and easy local method of treatment. It is not painful, it is not invasive, and it does the job.
I would say that's my favorite part, is coming home and knowing we're continuing the therapy, right? So I really, really appreciate that portion. Also makes sense why Oscar's been sedated before, and they've done, a local anesthesia by injecting through the nose. So that makes total sense. That's right there. Alrighty, thank you. And then next, in your experience, so, from being at this clinic, what are some of the results that you've seen other patients experience?
So mostly, as I mentioned, the biggest problem is speech, of course. So some children do not understand the speech, they do not speak, they do not recognize even their name. So this is the huge problem for all the parents, because they want to communicate with children. So first of all, and most important, I think this is the speech. Just giving you some examples. Of course, if the child wasn't speaking at all, he can start understanding words. He can start understand commands and react to the name. But if the child is already speaking, it can help the child to develop a better speech. For example, some children who spoke only one word, they wanted like an apple, they say apple. They are able to do some small sentences like, I want apple. And this is also a huge difference, because they can express themselves. They can say what they want, what they do not want, and parents understand them better. Yeah. So I think this is the most important. But also our children have many other positive benefits like they have reduced hyperactivity, which helps them to concentrate better, to learn better. Also, it helps them to learn the like hygiene habits, daily routines, like brushing teeth, like preparing meals. So this is also very important. We have children who benefited in almost every symptom that they have. So it's hard to say.
Yes, no, of course. I know with Oscar, the first ever, benefit that he saw was just being able to sleep through the night. That sounds so simple, but when you have a kid on the spectrum that wakes up every 3 hours and stays up for 3 hours, you never get any sleep as a parent. And so I know you said that like parents are looking to communicate. I can only imagine being the child, right, and not being able to communicate. So like finally being able to express, any pains that you have, any desires that you have. I can't imagine going to bed hungry and not being able to tell someone, hey, I'm hungry, so yeah, we're very excited. That's our next step between, his reduced hyperactivity, and then also the sleeping through the night. Also, Oscar used to vomit 7 to 10 times a day because he couldn't stand other people chewing. He couldn't stand looking at food. He, realized that it was easier to drink calories than it was to eat them because it came up easier. So he only drank fluid, and he couldn't be near us in the dining room. He could, nowhere was really safe. I mean, like, you have a kitchen in your house. What house doesn't have a kitchen? So, we're really excited to see the speech portion, but it has already benefit him and ourselves so much. So that makes total sense. I was like, I know what we've experienced, and so hearing that is making me very hopeful. One of the other questions that I received, more on the negative side, what side effects can you see from stem cell therapy in general? Like, what are the risks? What are the, side effects? I know if you mentioned to me, but maybe maybe you'll have more to say on that one.
Yeah, so as any kind of treatment, of course, stem cells treatment may have some side effects. Well, the side effects that we see at the clinic right after the procedures, usually they are very mild and they're very easy to cope with. It can be a short period of fever. It's a non-specific reaction of the immune system for just infusing something new. So it can be the fever and the headache, so the children may feel like if they are getting flu, so this kind of condition. It is usually very short, it's easy to cope with. And the second kind of side effects, they can show up in some time, maybe in a week or in 2 weeks. In some children, we see the increasement of hyperactivity. But this is just one step before the outcomes will be seen, because the parents can become very anxious. Why is he so hyperactive? I hope that he will be less hyperactive. But this third period of hyperactivity only showing that the stem cells start working. So then it will be gone.
Gotcha. No, that totally makes sense. I remember thinking, the way I kind of understood it as well, even after that little phase of maybe the hyperactivity, adjusting to new things in your body, right? It's definitely an adjustment period. It's like bringing someone new into your home, right? It's just an adjustment. Yes. But I do remember for Oscar, it was almost like he became more aware. And so he almost seemed more high maintenance per se, but it was more that he was becoming aware that he had an opinion, that he had emotions. And it was like the next step after that, once we started seeing all those benefits and improvements. So we gained the sleep, so I think we didn't really notice the hyperactivity too much, but then we remember there was like a frustration phase, a little bit of aggression, but it was more like he realized he was with it and he was like, I want this sucker, but we were working on getting those words out for him so he could actually, communicate with us. So I totally get the phases, because it is kind of like one step forward, or one step back, 2 steps forward, and honestly for him it was like one step back, we're holding our breaths, and then a huge leap, right, for our son. And obviously, results always vary. Speaking of results always varying, how many rounds do you commonly see children receive, or any patient, really? I know sometimes people say, oh, the sooner they get it, the better it is. The later they get it, the more times you have to come back. What's your professional opinion on that? Is that true, or is it more just, it really just depends on the kid or the individual, really?
This is really very individual. So in general, we say that it is better to start the treatment as soon as possible. So when the child is small, it is easier to affect the brain.
Do you have an age requirement? How old do children have to be to come and receive treatment? Do you guys have an age limit?
So nowadays, if the child wants to receive the living cell treatment, he has to be at least 3 years old.
Okay.
So we have the requirements for the age and also for the weight. So it has to be at least 3 years old. But some children, they have the diagnosis at the age of 1 or 2, and they really want to have the treatment. At this age, we can offer the cell-based products like exosomes. Exosomes can be administered to even smaller children, but the stem cells only from 3 years old.
That makes sense. Okay. And then, sorry to cut you off in the middle of your answer, but okay, so the sooner, that's what's encouraged. How many rounds do you typically see families come for?
If the child has no positive effect from the 3rd round, it makes sense to try at least one more time, because we've seen children who start benefiting from the 2nd or 3rd treatment. If there are no benefits at all, from the first and from the second treatment, unfortunately, we have to admit that the stem cells cannot help. That happens. But if the stem cells start working from the first treatment course, it makes sense to repeat it at least once a year. All the benefits that the child has from the treatment will stay with them. But
I would say they're permanent, but to get further, so it's almost like, trying to think of the best way to put it. It's like they gain all of this and then they kind of plateau, right? And then if they showed that they made improvements that aren't just, them getting older, right? If they've showed true improvements from treatment, then we add more treatments and then they're this much further. They're this much further. And so as they gain all this knowledge, it is permanent benefits.
Yes.
Okay.
So think of it like a stair. You have the stairs from the child that you have now, and you want to have like a perfectly healthy, speaking, well-developed child. And each treatment is one step. So as much steps that you make, the better outcomes you'll have.
Gotcha. No, that totally makes sense. Okay. And then you guys recommend yearly, not every 6 months.
It depends, from 6 months to 1 year. I think that it doesn't make a lot of sense to have the treatment sooner, because the stem cells will be working for at least 6 months. After 6 months, you can repeat, but not all of parents have this ability to come in half a year. Coming once a year also works great for some parents.
I was going to say, across the world, all the medical clinics that we have interviewed, they've all said, at least give it 6 months. Give it 6 months to see the full results and decide whether or not to go again. A lot of clinics also say at some point you'll realize you got to where you wanted, and oftentimes I've heard the ballpark of 3 tossed out there, but I think that really depends on the severity level of the kid, because that's just they might see a bunch of kids that are of a certain level or at a certain stage, and they just happen to be referred by parents that are hanging out with other people at that same stage, and so them saying 3 is about a max. I totally get what you're saying, every step, and who knows how many steps you're going to leap that time, right? So no, that's perfect. But I think that's all the questions that I had that I received before we went ahead and met, so I really appreciate you meeting with us.
You're welcome. But I hope that this makes a lot of sense for the people who didn't try the stem cells before. I know that they are scary, they're anxious, they do not really understand what to look for, so having this information is very good for them.
Awesome. No, that's perfect. I would say I think it'll help a lot of people. So thank you, Dr. Lana.
You're welcome.